Staff at the colorectal unit at Birmingham City Hospital have been piloting a brand new scheme enhancing the recovery of patients. Enhanced recovery is all about reducing patients' time spent in hospital, even after major surgery.
Only a few years ago, I remember patients after an operation, major colectomies, have to be in bed up to 10 days starved, no food, and that they stay in hospital up to 2 weeks. And now I see them going home after 3 or 4 days, which obviously has a significant benefit to hospital resources and patient recovery.
I think we both feel that enhanced recovery is very beneficial for the patients. Firstly, because they're mobilising earlier, so that reduces their risk of having a DVT or a PE. It also means that they're moving and breathing better, so they have reduced risk of chest infections.
To give you an example how this changes things for patients, I tell you about this 85-year-old lady who had an operation on Wednesday afternoon, and Friday morning she went home happy.
Staff right across the multidisciplinary team play their part. And although enhanced recovery is about getting patients home quickly, the process actually starts before the patient is admitted.
I'm going to give you some pre-op drink, which is a high carbohydrate drink. It administers nutrients and carbohydrates which would be lacking because they have been starved, and it replenishes these nutrients and puts the patient in an optimal state rather than a dehydrated state prior to them having this surgical insult.
The team focuses particularly on the psychological aspects of having colorectal surgery, such as any concerns around stomas, that's colostomies or ileostomies.
As a stoma care nurse, one of my roles is to educate patients pre and post-operatively with regards to their stoma care management. We have traditionally talked to a patient pre-operatively about the psychological implications of a stoma, but we've left the practical side until admission to hospital. But now patients are going to be discharged earlier. What we're tending to do is to use literature to educate the patient pre-operatively. This we find helps post-operatively. We're not using days up to go back to the basics. Those basics have already been instilled within the patient.
Advances in procedures mean that patients no longer require as much bowel preparation before surgery, and they can now even be admitted on the day of surgery itself.
I must explain what bowel preparation is. It is very strong laxatives which used to be given up to 2 days before the operation to cleanse the bowel in preparation for major surgery, but it used to result in dehydration of the patients. So now evidence has shown that that's not required.
Right from the point of admission, the colorectal team are working towards enhancing the recovery of the patient.
Each patient will be given an AIM-4 card. The AIM-4 card will discuss the daily milestones that we expect our patients to achieve. On the day of surgery, our patient will be sat out. They can drink and they can eat if they're able to tolerate it.
Major abdominal surgery can be done with very small cuts on the tummy, which means that patients, when they wake up, they have very small incisions, the amount of pain that they have is much less, and so we can feed them very soon after the operations. They are mobile straight after the operations, so they become independent and can go back to their normal activities of daily living within a day or two.
On day 1, they can walk. On day 2, we will take the epidural out and the catheters out, and the patient will be walking a little bit more.
We see them on a daily basis, often more than once a day, after they've had their operation. So the aim of that is to really encourage them to meet their milestones that they should be meeting after they've had major bowel surgery, trying to get them to mobilise as quickly as possible. And we also encourage them to eat and drink as they can tolerate, and we also try to remove drains and catheters as soon as possible, and that also means they can go home a lot earlier.
Day 3, patients should be able to shower and get dressed and be a bit more independent, and on day 4, in some cases, the patient will go home.
This enhanced recovery has been a great revelation for me. I was a great skeptic when we first started this, and I was very scared as to whether this would lead to bad outcome for the patient. So on a personal level, I did this only slowly, a little bit at a time. But now, after 7 years in the journey, I realized it's not only very safe, but it's actually excellent for the patients.
Enhanced recovery is a win-win situation that will benefit not only patients in the long run, but will benefit the National Health Service and the staff that are working within it.